knock, knock, knock. Hello, my name is Amber, and I'm going to be the nurse taking care of you today. I'm going to be doing a thorough lung and thorax assessment. So I'm going to get started by doing my hand hygiene. I'm just going to ask you a couple questions. So can you start by telling me your full name and date of birth?
Pat Velasquez, 12/3/63.
Okay, and then do you know where you are right now?
I'm at home
Do you know why you're here?
for assessment.
Do you know what today's date is?
11/15/20.
And then do you know who our current president is?
Trump.
Okay, so the patient is A&O times 4. So now, if I could just see your hands really quickly. Okay, and then let's look at your nails. Okay, so the cap refill was less than 3 seconds, and the skin is warm, it's dry, it's smooth, soft, and the color is consistent with ethnicity. So now I'm going to get started with the assessment. So first I'm going to inspect the anterior chest. So the chest is warm, it's dry, and there's no signs of skin breakdown or lesions. And then the respiratory rate is regular, it's symmetrical and non-labored. And then the chest ratio is 1:2. And then I'm going to percuss, so I'm going to start at the second intercostal space, and then the fourth intercostal space, and I'm going to go to the other side. Okay, so percussion sounds were resonant bilaterally, and then next I'm going to be doing tactile fremitus. So I'm going to put my hands on your chest, and each time I move my hands, just say the number 99.
99, 99, 99, 99.
Okay, so there's equal fremitus bilaterally on the chest. And then now I'm going to auscultate. So if you can just take a deep breath in and out every time I move my stethoscope. Okay, so there was clear lung sounds bilaterally, and then lastly I'm going to be doing the intercostal angle. So I'm going to place my hands on your chest, and then you're just going to take a deep breath in and out for me. Okay, so there on the anterior chest, the intercostal angle was equal bilaterally. So now I'm going to auscultate the lateral chest. So if you could just lift your arm up for me. I'm just gonna listen really quickly. Take a deep breath in and out. Okay, and the same thing on the other side. Okay, and there was clear lung sounds on the lateral chest bilaterally. And then now I'm going to be doing the posterior chest or the back. So if you could rotate a little bit for me, thank you. So first I'm going to start with inspecting. So the back is warm, it's dry, and there's no signs of any skin breakdown or lesions. So now I'm going to palpate, so just let me know if there's any pain or tenderness as I palpate. Any pain or tenderness?
No.
Okay, so patient denies pain upon palpation. So now I'm going to do the tactile fremitus one more time. So every time I move my hands, if you can just repeat the number 99 for me.
99, 99, 99, 99.
Okay. So there was equal fremitus felt upon palpation bilaterally. So now I'm going to get started with bronchophony. So I'm going to be listening with my stethoscope, and then each time with my stethoscope, just repeat the number 99.
99, 99, 99, 99, 99, 99, 99, 99.
Okay, so now we're gonna go to the whisper pectoraliquy. So if you can just whisper 1, 2, 3 each time that I move my stethoscope.
1, 2, 3. 1, 2, 3.
Can you whisper it for me? Okay.
1, 2.
Okay, so there was negative bronchophony bilaterally and negative whisper pectoraliquy negative bilaterally. And then lastly, we're going to do egophony. So if you could just say the letter E for me every time I move my stethoscope.
E, 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 E.
Okay, so there was negative egophony bilaterally. And then now I'm just going to auscultate your normal breath sound. So if you could just take a deep breath in and out for me every time I move my stethoscope. Okay, so there was clear lung sounds heard bilaterally on the posterior chest. And then lastly, we're going to do the intercostal angle one more time on the back. So if you could just take a deep breath in for me and out. Okay, so on the posterior chest, the intercostal angle was equal bilaterally. That's it.